much. Thank you for the invitation. Appreciate Lupus LA and all the great work that you guys are doing. And thank you for the opportunity to speak about a topic that I'm really interested in. So I was asked by Lupus LA to talk about the connection between lupus, celiac disease, and how to make sense of all of this, because you're hearing a lot about all of this stuff, and those of you who have joined this live cast are definitely interested in this topic. So we'll dig right in. I'm Swamy Venuturupalli, rheumatologist. I practice in LA, affiliated with Cedars. I founded Attune Health, which is a autoimmune center here in LA. So again, love Lupus LA, and thank you again for this opportunity. And I'll dig right into this topic, which is about celiac disease. So what is celiac disease? And the short answer is that it's an autoimmune disease, and it's triggered by ingestion of gluten. And it's actually really common, 0.5 to 1% of the population. So if you look at a population in the US of 350 million people, there's like 3.5 million people with this. But what's even more interesting is that patients who may not have the full-blown diagnosable celiac disease have something called non-celiac gluten enteropathy or dysfunction of the gut. And that's way more common. By some estimates in the literature, it may be as high as 13% of the population, 12 to 15% of the population is what I've read. So what happens is that the intestines normally have these structures. I don't know if you guys can see my cursor, but they have these structures called villi, which are little finger-like projections that come out of the intestine and increase the surface area of the intestine so that you can absorb a lot of nutrients. But these get really damaged when somebody has celiac disease and they flatten out, and that has lots of consequences downstream. So celiac disease is actually seen in combination with other autoimmune diseases, and about 30% of patients who have celiac actually have other autoimmune diseases. So one study that I wanted to highlight is that 130 patients who had lupus were tested for celiac disease, and about 40% had intestinal symptoms, and 3% actually ended up having celiac on biopsies. And lupus and celiac, they can go hand in hand. It's hard to know. Some of the GI symptoms that are seen in celiac can be seen in lupus and vice versa. And non-GI symptoms seen in celiac disease, such as muscle joint pain, as you all know, anemia, etc., can also be seen in lupus. So it's hard to sometimes differentiate. You have to think about it. You have to be aware of it. And you as a patient should be aware of what your body is doing when it's exposed to gluten. So those are things that I would say. Now, what is the connection between celiac and lupus? This has been extensively reported in a recent paper, which I tried to summarize here. So imagine celiac and lupus as being part of the same continuum. What do we see in both of these conditions? One is that there are nutritional deficiencies that are a common thread. Two is that there are environmental factors, including things like your gut microbiome. We see a lot of IgA deficiency in both celiac and lupus. And then we see viral sensitization. So patients with lupus, for example, have had Epstein-Barr, which is mononucleosis, and other viruses. And we see reactivation of these sorts of viruses in both celiac as well as lupus. So there's a lot of connectivity between celiac, lupus, as laid out in this very nice review paper, which I've referenced here. Alessio Fasano is one of the leading authorities on celiac disease, and he's also done original research which basically lays the foundation for this connection of celiac disease as an autoimmune disease. So the three things that we know about celiac disease is that one is you need the genes. HLA-DQ2, DQ8 are the ones that have been described. And then you need some sort of a environmental trigger. In this case, it's gluten, or it can be other environmental triggers. And the last part is you need an immune system activation, which is the autoimmune disease. And as you can see, we see all these three things overlapping with each other in celiac disease. And in addition to the factors that I outlined, there's a possibility that there's leaky small intestine, which may cause this problem. So it's important to think about leaking and what it actually means. Like, you've heard leaky gut, and you've heard some of your doctors like roll their eyes when they hear leaky gut. So it's not a great term from a medical perspective, because it's not very descriptive in a scientific manner. But here's what they mean. So if you look at your small intestine and take a little section of it, as this little diagram is doing here, what you have here is the lumen, or the opening of the intestine, which is filled with bacteria in some cases, IgA, other defense mechanisms, defensins, other proteins. The cells that line the gut are called the epithelial cells. And in between those cells, you'll see here in this area that the gap is very small. In fact, it's tight junctions that open up just when something that's important to be sucked into the intestine needs to be sucked into the intestine. So for example, if there's a food particle that your body is interested in ingesting, it'll just open up those gaps and it'll all go right through. That's how it normally functions. But in leaky gut, so-called leaky gut, what we see is an alteration of the mechanics of this particular mechanism here. So again, going back to Alessio Fasano, he discovered that there was a protein called zonulin. And this zonulin basically is a mechanism which makes those junctions really tight. And if zonulin is not working properly, it can lead to that mechanism of tight closure. Imagine a gate which allows only certain things that need to go through in this area to go through. That gate opens and shuts under normal circumstances. Zonulin affects that. So Fasano presented that zonulin is a master regulator of intestinal permeability, and anything that causes problems with zonulin will also cause problems with leaking in the gut. And what we find is that from gluten, there's something called gliadin, which is a protein part of one of the proteins of gluten. And these are not completely digestible, which is what makes gluten so problematic for humans. But especially nowadays, there's theories that because of the genetic modification of our grains, old world gluten was probably not as bad as new world gluten. That's one theory. I'm not sure I believe it, but you know, it's a theory. And the other theory is that we're consuming way too much gluten. It's in pretty much every food that we consume. Any processed food, anything in a bag will have some gluten hidden in there. So undigested gluten basically makes its way to the small intestine and causes problems there. And here's a beautiful schematic which I wanted to share with you that lays out all the steps of how the gut can get leaky. And so first of all, you have these indigested fragments of gluten which reach the small intestine, and under the effect of zonulin, these gluten fragments cross the intestinal lining and get into your mucosal layer, which is where they start making these cells secrete some inflammatory molecules, which then transforms the gluten and attaches additional proteins that are recognized by the immune system. So the gluten now gets recognized by the immune system, and the T cells then cause helper T cells and killer T cells, et cetera, to form, which then go and damage the gut. So that's the schematic of how all of this is working and why gluten is bad and why patients with celiac disease can have an autoimmune-like condition. There's also the hypothesis of what are the gut microbiomes doing there, and are they helpful, are they not? So we're finding that in a lot of our patients with lupus, for example, that the gut microbiome, which is the whole totality of all the microbes in the gut, is not diverse. We find that in healthy people, you have a very diverse microbiome. So there's different kinds, good bacteria, bad bacteria, but the bad bacteria are kept under control by the good bacteria. So when there is an overpopulation of one type of bacteria or a few types of bacteria, it's called gut microbiome dysbiosis. So that's another factor that's playing a role in this inflammation in the gut and can produce more inflammation. So zonulin is a good biomarker that's been established through multiple scientific studies, which are here. And then a quick word about the non-celiac gluten sensitivity. So this is a syndrome. A lot of patients will have intestinal symptoms in the presence of gluten, and they may be diagnosed as having irritable bowel syndrome, but they may also have systemic manifestations like foggy mind, headaches, fatigue, joint muscle ache, dermatitis. And I would urge everybody to start paying attention to their diet and really think about what are the things that are causing these symptoms and to eliminate those items from your diet. So I think that's the presentation part of my discussion today. I'm going to take a few minutes to now talk about some of the questions that have come through the community. Brianna, is that good, or do you want to ask me some questions, or what do you want?
Yeah, that's perfect. I'd love to dive into some of our community questions. Thank you so much for that, Dr. B.
Sure.
Welcome. One of the questions that we received was, is it true that people with celiac disease have a higher risk of developing lupus?
Yeah, patients with celiac disease are at risk for developing other autoimmune diseases, including lupus. And the answer is yes, short answer.
Interesting. And then is it true that people with autoimmune diseases in general experience a reduction in symptoms following a gluten-free diet, or is that a myth?
It's not across the board. It's when you know, obviously lupus is many different manifestations of a disease that we lump together called lupus. So, for example, in some patients, the gut inflammation may be a huge factor in their presentation, and in those patients, in my experience, I have found reduction in symptoms. And what's important to remember is if you're a patient, just stopping gluten for a day or two is not going to make a difference. This is a process. This takes weeks, months to happen. So if you stop gluten today, I tell my patients, don't expect too much for 6 to 8 weeks. After that, you know, everyone's like, oh, this is doing nothing. And then they go back and they try gluten, and then they see, oh my God, all these symptoms have come back. This was actually playing a role. So that's been my experience.
Wow. Yeah, we had someone ask, how long do you have to be on a gluten-free diet to see if you have a problem with gluten? So you're saying it's like at least 6 to 8 weeks before you can kind of definitively see.
Yeah, and I would say even longer. I mean, if you're really serious about changing your life and lifestyle and health, I mean, I would do a really rock solid gluten-free diet for 3 to 6 months before I write it off.
Okay. And I think you covered this a little bit in your presentation, but someone asked, can you get gluten sensitivity at any point in your life, or is it something that you're born with? Same with celiac. Is it something you can develop, or is it something you're born with?
Absolutely, yes, because as you saw in that Venn diagram, it requires 3 different elements. One is you need the genetics. So even if you have the genetics, it doesn't mean you're going to get the disease. Then you need something from the environment that turns on the genes. And so we definitely see it later on in life. I think that there's a cumulative effect of gluten. I think we're feeding our kids, even I'm guilty of that, too much gluten in their diets. And I think that over a period of time, I see a lot of patients in their late teens, 20s, 30s, even sometimes even the 40s, you might get by. But what we're seeing is that as the gut microbiome gets less diverse, as we start putting more processed foods into our body and not healthy whole foods, as we get reliant on quick sources of energy like bars and cookies and crackers and those sorts of things, over a period of time, the gut starts dysfunctioning. And it's only after that that we start seeing the problems occur. So I see most of the patients, depending on the strength of their genetics, it can happen. If the genes are really strong, then you'll see it earlier on in life. If they're kind of weak, then you'll see it later on in life. I mean, like in the 30s and 40s.
Interesting.
Yeah.
Okay. Along the lines of lupus patients and GI symptoms, someone asked, does it make sense for lupus patients to be tested for food sensitivities in general, even if they don't have major GI symptoms, or do these tests show false positives?
Yeah, I think you answered your own question, because you know that they tests show a lot of false positives.
Okay.
They're not great. They are the best thing we have right now, but they're not great. I'm hoping that we get better testing for food sensitivities. I mean, I think the best test for food sensitivity is to eliminate whatever foods are problematic, and then slowly reintroduce them one by one over a period of time. And we work with a lot of patients in our clinic with our nutritionists on that aspect. We kind of really guide them and help them make sense of the symptoms if they're coming back, and what's happening really. So I think that's the best test. The blood tests are not great, unfortunately.
Okay. And Heidi is asking, is the damage from leaky gut and gluten sensitivity reversible?
That I believe it is, but I don't have a strong scientific paper to quote you, but I do believe it is. I mean, I strongly believe in the human body being able to heal itself if we get out of the way and let it do its job. I think that that's kind of a philosophy that's served us as humans quite well over the millennia, and that if you look at all traditional methods of healing. And we've seen a lot of that in my career too. I see patients able to help themselves and get much better. So I do believe that there can be healing of the gut. If you think about it in this term, every day the epithelial layer, the first surface layer of the gut, is replaced. So you have a new one coming out every day. So that's in one opportunity every day. You get a new gut lining and to repair things. So I do believe in that.
That's very motivating. In terms of being able to make changes.
Absolutely. I think so.
Do you have time for one more question, Dr. B?
Yeah, I can take it.
Is it possible to be misdiagnosed with lupus when you really have celiac, or are the blood markers for diagnosis too different?
Yeah, I mean, it is. So if you think about it, the state of the art, it's 2023, and we still don't have precision medicine. So for example, what we call lupus is really a collection of different diseases, in my opinion, that we know only so much about. So we lump them all together because they all have some characteristics. They might have a positive ANA. They might have some other marker for antibody marker for lupus. They may have headaches. They may have rashes that are very similar to lupus. So, but one patient with lupus with kidney disease is very different than a patient with lupus who has skin disease or joint disease or achiness and mental fogginess. So, our criteria for lupus are evolving over time. So what we may have diagnosed as lupus 10 years ago, for example, now we see the same patient, may call them something else. So yeah, I mean, absolutely. I think it's possible that you may have celiac disease and present to a doctor and they find an ANA and you meet criteria for lupus too, and you meet criteria for celiac disease. So, and it's possible that you have both or one of them or both together, or one problem is working at one time and the other problem at another time. So it's just, humans are complex biological systems, and getting 100% certainty on diagnosis is really hard. It's the holy grail in medicine right now, and we're working hard towards molecular diagnostics and precision medicine. And hopefully over the next decade or so, we'll have better ways to diagnose people more accurately and give them more reassurance about their conditions and diagnoses.
Certainly, we hope so. Before you go, Dr. B, can you just let us know if somebody's a lupus patient is suspicious of GI issues related to gluten, do you recommend that somebody kind of plays with a gluten-free diet, or do you recommend that they kind of go directly to their rheumatologist or a GI to kind of get evaluated?
I mean, this is a tough question. I mean, obviously having a professional set of eyes on your problem before you start playing around with it and getting a diagnosis. And most importantly, if you have lupus, the reason to see a doctor is that the doctor is trained to figure out if you have a potentially bad situation that's brewing and getting worse. And, you may lose a lot of, I see this time and again that people want to go to natural doctors,
Sure.
play with things. And sometimes, I mean, oftentimes it turns out okay and it's fine. Sometimes it doesn't. Sometimes people lose, days, weeks, months, and you can, lupus is not something you mess around with. It can, as you all know. can turn on you quickly, and it can become really strong and attack your organ systems and take out your kidney or your liver or cause a heart problem or something like that. So it's not something that I would take lightly. And if there is a suspicion from any of your physicians, your primary care, or anybody else is suspicious of lupus, I mean, I would take it seriously and get it checked out, make sure that you don't have a bad kind or something that's brewing that's going to be dangerous to you.
Perfect. Thank you so much for your time, Dr. V. We really appreciate it.
Welcome. My pleasure. Take care.